Welcome to the Baby Bunting Live series. This is Season 2 and Episode 24. Tonight we're discussing teething. We've invited Belinda Joyce along to answer our questions as well as yours. Belinda is a midwife, maternal and child health nurse and author of Survive and Enjoy Your Baby. Thanks for joining us again tonight, Belinda. We're going to be covering all things teething, so if you have any questions through this episode, please pop them into the comments box and we'll answer them towards the end of the episode. So Belinda, let's talk about teething. What is teething?
Teething is really the process that babies go through where their teeth are erupting and coming through the gums.
And when do babies first get their teeth?
Most babies get their first teeth between about 6 and 12 months of age, although some get them a little bit earlier and some babies get all the way to 12 months without having any teeth through just yet.
And are babies born with teeth?
Look, some babies are actually born with teeth. It's a really small percentage of babies, but some of them are born just with one tooth or maybe two, or they get them in the first couple of weeks of life. And sometimes they do need to be removed if they're a little bit wobbly. There could be a choking risk, or if they're causing breastfeeding issues or feeding issues.
Okay. Yeah. So which teeth would you normally come through first?
The most common teeth to come through first, I'll use my little tooth model here. So the most common teeth to come through first are the central incisors at the bottom down here, and then usually the upper central incisors straight after that. We then often get the lateral incisors, so these ones here and here, and then we get the canines later. And somewhere between about 1 and 2 years of age, we usually get the first set of molars, and then the 2-year-old molars between 2 and 3 years of age.
And how many teeth in total will baby get?
Yeah, so they're actually born already with 10 upper and 10 lower teeth underneath the gums, and so they'll gradually come through. Yes.
Yeah. And do teeth come through in a different order, or is it a specific order?
The order that I just showed you is the most common order, but it's not. It doesn't mean that your baby's doing anything wrong if they come through in a different order. They're often called cross-cutting when they're not coming through in the expected order, but many babies cross-cut and it doesn't mean that there's any issue. Okay. However, if you were concerned, if say the teeth were an unusual shape or you were concerned that it wasn't kind of going as you had expected, talk to your GP or your maternal child health nurse or a dentist.
And when would a parent expect to have a full set of baby teeth on their child?
Yeah, so by 3 years of age, you've usually got that final second set of molars through, and usually then you'd have the full 20 teeth.
Okay, by age 3. I've heard that teething can be painful. Is that true?
Yes. Look, there are some babies that are really resilient, and a parent will say, oh, look, I just found a tooth in their mouth and there was no symptoms, I had no idea it was coming, but I think they are a smaller minority of babies who are able to get those teeth through without it causing quite a bit of discomfort. I think often it's more uncomfortable than really extremely painful, but babies don't understand what's going on. Yeah. So I think it makes it really difficult. You can't explain it to them. All you can do is give them some extra love, and we'll talk about some strategies afterwards as well.
Oh, terrific. And what are some of the signs and symptoms that parents can be looking for?
Yeah, so you'll know your baby's teething if you're seeing things like, I'll give that to you.
Thank you.
If you're seeing things like lots of drooling, red cheeks, actually feeling a lump on their gum, often it is down the bottom in the middle or at the top in the middle, seeing the swelling, maybe they're not sort of really wanting to feed very much, they're not wanting anything in their mouth, not really letting you have a look in their mouth either. And you'll often see that they're chewing on everything. So their own fingers, your fingers, any toys that they have, anything that they can sort of get their hands on, they will often bite on and get quite a deal of relief from that as well. And
during teething time, yes, is it common that babies may not want to feed and may not want to eat their solids, off food?
Absolutely, because their mouth's quite inflamed, so having food go in there, particularly if they were onto solids and you're putting a spoon in and out of their mouth, it might hit the sore parts. Even the chewing process, if the food was hard, it could be a good thing or a bad thing, in that it might be painful or it might actually be quite soothing as well.
Okay. And nappy rash, I've heard that's also a symptom.
Lots of babies do get a bit of nappy rash. It appears that their urine's a bit more acidic at that time. So if you know that they're teething, just maybe using some sort of a barrier cream, but also just changing the nappies a bit more often.
Okay. And will teething cause fever in babies?
No, not really. Although fever tends to go hand in hand with teething, it's not because of the teething. So we think that babies' immune system actually drops and they get a bit run down with the teething because often they're not sleeping as well and they're sort of out of sorts. So if your baby does develop a temperature, it's really important to look at anything else that you think might be medically, of concern with your baby. So maybe they've got a sore ear, maybe they've got a sore throat, and you may need to see a doctor.
Okay. And if a baby is showing these symptoms, does it generally mean that a tooth will come through soon?
Not necessarily.
Okay.
It's really tricky. So some babies can be teething for many months on and off. It shouldn't be continual, but on and off, where you might see a lump come up on the bottom gum and all of those teething symptoms, and then the lump actually goes away, and then it comes up again and it goes away. The two front teeth, often you'll see them through the gum, and they tend to come out through the front of the gum, which is interesting too. But it can be paper thin, that gum, and you can see the teeth and then they can disappear again. So sometimes they can come through very quickly and other times they can take a really long time.
Okay. And so through that whole process, is sleep often disrupted?
Yes. Sleep is really often disrupted with teething, and you can understand why. If we've got something in our mouth that's sore, it's disruptive, but for a baby they don't know what's going on either, and if it's painful it's really hard to sleep, or if they're in light sleep and they're in pain, they're more likely to sort of arouse and need some comfort, maybe a feed or something like that. So it's really common to start that sort of disrupted sleep pattern because of teething, and they might have slept really well up until this point. But if it's going on for weeks and months, it's probably not the teething that is now causing the sleep problem. It's just that they've gotten into a bit of a habit. So if you're finding that your baby is really needing a bit of support with sleep, and you are as well, talk to your maternal child health nurse about some strategies that you can use to try and get your baby back into a better pattern. We don't have time to go through all of that this evening.
We can do that on another series.
Yep.
And so what can parents do to help comfort their poor little ones when they are teething?
There's lots of things you can do to help. Like I said, babies really love chewing on something. So their own fingers, they'll often do that themselves, and your finger, make sure it's clean, but they will enjoy chewing on your finger. So long as they're not causing damage, that's absolutely fine. A cold, wet sort of face cloth can work really well. So if you just pop it in the fridge in a container or a bowl or something, and pull it out and let them chew on that, they really love. I think it's just very soothing on the gums, and they can hold onto it themselves, and it's cool as well. And then there's some great toys and things that you can use too. So gel-filled teething toys that go into the fridge. Just don't put them into the freezer. They can get quite brittle and we wouldn't want the gel going into their mouths. But they are really good. They've got lots of textures on them too, so the baby can actually work that against their gum. And then for an older baby, something that they can also play with and really manipulate. And again, it's got all the different colours, but lots of different textures on there. And there's a few other similar ones. This one's really clever because it's a dummy that they can actually bite on and chew on, and in a safe way as well. So there's a few different options there.
Oh, that's fantastic, Belinda. Thanks for showing us those. And what about teething necklaces?
Look, the amber teething beads have many people have been using them. They're not considered or recommended by experts or by the ACCC, and that's because there's a really real risk of suffocation or strangulation, I should say, or swallowing a bead as well. No matter how carefully these things are put together, they are still beads. So they're not at all recommended. There's no medical evidence that actually shows that they do take away teething pain either. So it's not worth the risk.
Okay, so you have provided and shared with us lots of strategies and some toys and teethers that can be used. If they're not providing relief, can medication be used for pain relief for teething?
Absolutely. Yep. So if you or I were in pain, we'd probably take something for pain relief, and I think it's only fair that our babies are given that as well if you think that they are in a lot of pain from teething. So there are over-the-counter teething medications that you can talk to your pharmacist about. And then there's things like paracetamol and ibuprofen that are great options as well. None of these things should need to be used every day, and they shouldn't be needing to be used every day for multiple days in a row either. So sticking to always the dosage instructions and looking at the weight of your baby is really important rather than age. And then if your baby is needing those things a lot, then you really do need to see your doctor.
Okay, so that is a definite recommendation that we should take the baby to the doctor if we feel that it's inconsolable.
Yes, absolutely, especially if those medications aren't working.
Yeah. Okay then, lovely. And how can parents care for babies' first teeth?
So once your baby's got those teeth through, it is really important that we look after them from day one. I know it seems early, but we now know the importance of oral hygiene, and our baby teeth actually make the spaces or keep the spaces open for adult teeth. So we want to get onto it straight away. So just a wet washer. So you're probably going to be washing your baby's face anyway. Let them have a chew on the washer. Wipe around their teeth if they'll let you. They probably will on and off in between, sort of when they're a bit more inflamed in there, they might not let you, but just do the best you can. And there are some really great little devices out there, so a little finger stool with sort of a silicone brush on it that's quite soft, and you just pop that over your finger and rub it on their teeth. And then by 12 months we'd like just a small toothbrush, a really soft toothbrush that's aimed for this age group, with just water is all you need. And again, if they're still just getting teeth through and it's quite inflamed in there, just be really very, very gentle. We want them to think that brushing their teeth is fun, because they're going to need to do it for the rest of their life. We don't want them thinking it's an awful thing to do. And then from 18 months onwards, we use just a small smudge of toothpaste. It does need to be the appropriate toothpaste for that age, because it's lower fluoride and they're not very good at spitting it out.
That's true.
Yeah.
Do you have any lasting thoughts on teething, Belinda?
I think the most important thing is that when it's another milestone that your baby's going to go through, and it's really important. They need those teeth. They're going to be able to eat so many more foods with a good set of teeth. But I really do feel for the babies and the parents when they're going through the teething phases. It can be extremely exhausting. Just know that you need to move through it and hang in there. That it will come and go for a little while, but it will go away eventually.
Oh, Belinda, thank you. And it is a stressful time, and no parent likes to see their child with any pain. We have a question tonight.
We do. Joyce has asked if natural teething powders are effective.
Look, I'm not aware of what ingredients are in the teething powder that she's asked about, and I don't really know enough about it. I think it would be really good to have a chat with a pharmacist about that. I'm so sorry, I don't have a better answer.
And Emma has asked how often and how long should she be brushing baby's teeth once they emerge?
Twice a day would be really good. If you're wiping your baby's face after they've eaten, and perhaps they're eating 3 meals a day, in their second 6 months of life, If you're washing their face, because they do tend to get food all over their face, then I would just wipe over their teeth each time, because you know they've just been eating. But otherwise, as they get older, and you're brushing, for instance, twice a day is usually enough. Yeah.
So similar to us, and
Yes.
just creating good habits early.
Definitely.
Yeah. Belinda, thank you for all these wonderful insights tonight. I'm sure that many of our new parents have taken away some useful tips, and so greater understanding of the teething time and what to expect through this period. So remember that you can see more of Belinda and her book on her website that we will link to on this Facebook page tonight. Thank you to everyone for joining us again tonight for Baby Bunting Live Series. We look forward to seeing you next week. If you do have any concerns with baby's health or specific questions about the topic we've covered tonight or any of the topics that we cover each week, please refer to your maternal and child health nurse, doctor or specialist. Good night to all.